Okay, with that, I would like to introduce our opening speaker. We have Christina Corriere, who serves as the Health and Human Services Policy Advisor to Governor Doug Ducey. Christina is our main point of contact with the governor's office. She really understands our day-to-day operations, as well as that of a complex and large public health network. So please join me. Welcome, Christina.
Hi, thank you all so much for coming today. It is a great pleasure to have so many partners here today. We're extremely pleased with the interest level. This filled up 2 weeks ago, and we've been on a waiting list ever since. And that really shows how seriously our provider community and our public health community is taking this issue and ensuring that Arizona is one of the most prepared states in the nation. We are very pleased to have participants from all across our great state and across a large variety of providers, from physicians to hospitals to insurance plans to educators and researchers. I would like to extend a special welcome to some of our distinguished guests. We are extremely pleased to be joined by our public health counterparts from the Ministry of Health from the state of Sonora. We have with us Dr. Gilberto Ungson, Dr. Luis Becerra, Dr. Gerardo Alvarez, and Dr. Filiberto Perez Duarte. Diseases like Zika can easily cross over borders, so communication and coordination with our Mexican partners is essential, and we greatly appreciate their participation here today. So if we could all give them a round of applause. I know she hasn't quite arrived yet, but I would like to welcome Heather Carter. She is our distinguished House Health Chair, and for all of those of you who have worked with her, you know what a great voice she is for both our providers and our patients and our public health community. So when she does get here, please be sure to say hi and welcome her. We have an important role to play in preventing and controlling Zika here in Arizona. This disease is unique in that it's the first mosquito-borne disease discovered to cause birth defects. As a border state with areas known to have the type of mosquito that carries Zika, there is a risk of it spreading in Arizona, and we must be ready to respond quickly. This summit is a call to action. We cannot allow the disease to become endemic. Like small fires, we need to quash this disease before it spreads. We need to come together, build our knowledge, and prepare our state. We must do all we can to protect the most vulnerable, and in this case, that means our pregnant women and their unborn children. There is much we don't know about Zika, but we do know how to prevent it and how to contain it. Vigilant surveillance for possible cases and engaging our communities to protect themselves by removing mosquito breeding sites, screening windows and doors, and using mosquito repellent is critical. We have already done a lot of planning, much of it we plan to share with you today, but we still need your input and suggestions so we can be fully prepared to have a successful response to this emerging disease. So thank you all to your commitment to work here today to fight the Zika virus in Arizona. And with that, I would like to introduce our Director of Health, Dr. Cara Christ. We are extremely lucky to have such a fantastic director here in Arizona who is so fully committed to public health. The governor has said many times, I'm sure you've heard, that he wants Arizona to be the healthiest state in the nation. And part of that means we're one of the most prepared states in the nation to handle disease outbreaks. And you are in good hands, and the state is in good hands with Director Christ. So thank you.
All right, good morning, everybody. As part of our social media campaign, they asked me to get a picture from the podium of the very full room. So if I could have everyone just smile for me. I'm gonna take a picture. Oh, wow, I don't even know I can get the whole room in. All right, everyone say cheese. Perfect, all right. Now I'll go ahead and get started with our talk. Can I use the advancer? Okay, thanks, Paul. All right, like they said, I'm Dr. Cara Christ. I'm the director of the Arizona Department of Health Services. But those that know me know that I love moms, I love babies, and I love infectious diseases. So someone came up and they're like, this is your trifecta. And I'm like, in a really weird, bad way? Yeah, it is. So I'm going to give the overview of Zika and talk about what we know, what we're doing, and then also what we don't know and what we're looking into, so that we start the day at the same level playing field, because we're going to get a lot more technical and a lot more information than my basic Zika 101 that I'm going to give you today. So what is Zika virus disease? You've been hearing a lot about this. There's a lot of information in the news. CDC has been calling this an unprecedented disease. It is an arboviral disease, which means it's spread by mosquitoes. It's vector-borne. And we've been watching it actually for quite a while. So we're going to go into it. One of the things, if anybody knows me, they also know, in addition to moms, babies, and infectious diseases, I love Disney. I am a huge Disney fan, which made Star Wars, which I'm also a fan of when they got bought. I'm a huge fan now of Star Wars. And so just to give you an example, I look for public health in every movie that I watch. And how many people saw the first trilogy of Star Wars, the ones with Anakin? And yes, okay, so I'm a big fan. And you may not think that there's public health in there, but there is. And when you look at global health security, we know that infectious diseases are just a plain right away. And I don't think I could have said it better than Qui-Gon Jinn, who was talking at the time to the Gungans about the Naboo and the need to help the Naboo. So the clone army, right, was coming down. Yes, I love Star Wars. The clone army is coming down, and they are going to attack the Naboo. And Qui-Gon Jinn was trying to elicit the help of the Gungan, and he said, "You don't understand. What happens on this world happens to both of you. Their fate will be your fate." And what we need to understand, that infectious diseases that happen in other parts of the world can happen here in the United States, can happen in Arizona, and we need to be prepared. And Zika is one of those diseases. So let us tell you about what Zika is, what we know, and how Arizona is prepared, and find out things that we still need to do. So where has Zika been found? So we've known about this disease since 1947, and it was found in the Zika forest in Uganda in 1947, but they've actually done blood tests, and they've found it serologically in different countries throughout Africa and India. At that time, there were only 14 documented human cases. However, in 2007, there was an outbreak in Yap, Micronesia, and they estimate that about 75% of their entire population was infected with Zika virus. However, they noticed only 20% of the people that were infected actually experienced symptoms. So they estimated about 900 people had symptoms. During 2013 and 2014, they noticed that there was continued spread along the Pacific Islands. So the French Polynesia, Fiji, the Solomon Islands, Easter Islands started experiencing Zika virus outbreaks. And so they were able to kind of follow that across until 2015, Brazil noticed its first cases of Zika in Brazil. Through May and July, they noticed a neurological disease called Guillain-Barré in the northeastern states of Brazil. And they noticed that they had an increase of Guillain-Barré. They noticed that they had about 121 cases. And by December, they had identified it in over 18 states in Brazil. I think that this is a really important time to talk the difference between locally acquired cases and travel-associated cases, because this is going to play a big role when you're listening to the media about Zika virus. So local transmission is actually when it is being transmitted from mosquitoes in a specific area. So somebody who has not traveled to another country, someone who has not left Arizona or that country, comes down with Zika, or in this case, chikungunya and dengue, and we'll talk about why that's important. But they have not left, so the only place that they could have gotten it was at home or in the area that they live, work, play, which is different than an imported case. So these are your travel-associated cases. These are people who traveled to a country where it is being transmitted, were infected by a bitten mosquito, and then came back to their home, and then came down with symptoms and were diagnosed at home. A travel-associated case means that it's not being spread locally. They did not get it at their house. They got it somewhere else and brought it back. Arizona has had three travel-associated cases. There have actually only been travel-associated cases in the continental United States. We do know that there are locally transmitted cases in Puerto Rico, the Virgin Islands, and the United States territories. But local transmission has not occurred in the continental United States. So where is Zika now? And when we are saying where Zika is here, that means that there is actual local transmission. So it is being transmitted by mosquitoes in these countries. And you can see that it's Brazil, parts of South and Central America, up into the southern portions of Mexico. It's very important to notice not all states in Mexico, just like not all states in the United States, have local transmission. So we've been working very, very closely with Sonoran health officials to identify where Zika is happening, and it has not happened in Sonora yet locally. It also happens in the Caribbean and then the United States territories. In the United States, you will see that we do have travel-associated cases. So the darker green means more cases. And this is as of May 18th. We had 2 newly identified travel-associated cases last week. They are actually not represented on this slide. Arizona would be a little bit greener. But as you can see, we've got states that have had a lot more cases of travel-associated Zika than Arizona has at this point. So how many cases have been reported? So we're going to contrast now. In the United States territories as of May 18th, there have been 836 cases. 99% of those have been locally acquired, and they've had 5 cases of Guillain-Barré. So a very, very small proportion have had the neurologic complication associated potentially with Zika. In the United States, so this is the 50 and the continental United States as of May 18th, there have been 544 cases. All of them have been travel associated. 10 of them have been sexually transmitted from a partner who had travel associated. So we still consider that travel associated because they are not getting it from a local mosquito. And we've had 1 case of Guillain-Barré in the continental United States. And I'm sorry, it went to instead of my picture, it went to me. So I'm going to look up here. I don't like looking at myself. So we've had 3 travel-associated cases in Arizona as of May 24th. So we're showing you the most up-to-date Arizona information. All of them have been travel-associated. Arizona's mosquitoes do not have Zika, and we have not had locally transmitted Zika in Arizona. So let's talk about how you get Zika. The primary transmission mode is being bitten by a mosquito. So a mosquito that actually has, you can see here, a mosquito bites somebody who is infected with the virus. So when you're outlined in red, that means you have Zika. So the mosquito bites them, then becomes infected, and then can go on to bite other people and infect healthy people. So then you have more people that have Zika, and then they can be bitten by other mosquitoes, and the cycle continues. There are other ways, but they're much more rare for how Zika is transmitted. So primary method, mosquito bites. That's how most people are coming down with Zika. A pregnant woman, and this is really important, and we'll talk about this more later, but can pass Zika onto her fetus while she is pregnant. We do know that we've got documented sexual transmission of Zika virus, and then there's the potential for blood transfusion, so transmission through people getting blood. So we get asked this a lot. What is the incubation period in mosquitoes? So how long does it take for a mosquito after they bite somebody who has Zika to actually become infected and be able to transmit Zika to somebody else? So it takes about 10 days for the mosquito to develop Zika and be able to pass it. So if we got bit today by a mosquito, that mosquito, you would be able to transmit it next week or potentially the week after. And the mosquitoes, I believe, live for about 30 days is their lifespan. So it would take them 10 days, and then they'd have, if they got it right away, they'd have about 20 days that they could pass on Zika. Once a person gets bitten by a Zika-infected mosquito, it takes about a week to develop symptoms. So you can imagine you could be on vacation, get bitten by mosquitoes, come back, and 3 days after you return, depending on when you get bitten by that mosquito, you could come down with Zika. Oh, and there's me again. All right. So the symptoms, and this is one of the things that makes identifying Zika a little more difficult. So only 1 out of 5 people who get bitten by an infected mosquito and get Zika are going to actually experience symptoms. So about 20%. The most common symptoms, which all of you are probably going to look at and go, I've got like 3 of those right now. But it's fever, rash, joint pain, and red eyes or conjunctivitis. I think we had been up all night the night before the Zika summit, and we were sitting there talking, and I looked over at Jessica and I said, I have all of those. And she just laughed. She goes, yeah. So they're very, very nonspecific symptoms. And a lot of these aren't symptoms that you're actually going to go to the doctor for. This is something that you can take some Tylenol, ibuprofen, and the symptoms will probably go away. You may have a low-grade fever. But a lot of people may not go to the doctor to be evaluated for Zika. Most people, like we said, are going to experience no or mild symptoms. And the symptoms, like we said, are very nonspecific. It's not like measles where you get a really high rash, high fever, and you come down with a rash, and you are so sick you're going to go to the emergency room. People may forget about having symptoms because they may be so mild. And the symptoms are going to go away about a week after you develop them. The good thing, if we can talk about a good thing for Zika, is that most people, we believe, are going to experience immunity after they've had Zika. So they'll be immune from future Zika infection. The scary thing about this disease, and trust us, we know that this is terrifying to women who are pregnant or people who are becoming pregnant. Zika virus does have an impact on pregnant women. It can pass from a pregnant mom to her fetus during the delivery or during the pregnancy. And while there have been no reports of the virus spreading through breastfeeding, so we are encouraging moms who just delivered to breastfeed, there is still a lot that we don't know, and we're going to get into that. One of the things that they do believe is that previous Zika infection does not appear to affect future pregnancies. So they believe if you get pregnant and you have or you get Zika while you're pregnant, it may impact that pregnancy, but it shouldn't impact future pregnancies. And we do know that Zika virus has been linked to a birth defect known as microcephaly. So this is when a baby's head is much smaller than is expected for babies of the same age and sex. So we'll show you some examples. So this is the baby with the typical head size. This is a baby with microcephaly, so you can see here, if you can see that dotted line, that's where the typical head size would be. And then you can see here's a baby with severe microcephaly, and the typical head size line is right there. So these babies can have developmental disabilities, they can have neurological disabilities, it can impact them going on. And we don't know what the impact is if they were infected while they were a fetus or at delivery. If they have a typical size head, will they have developmental or other neurological problems as they grow up? So we don't know what the impact is for babies that don't appear to have a birth defect. We also don't know if there is a worse time for moms to get infected during pregnancy. We suspect it would be at the end of the first trimester, beginning a second trimester, but they've seen people get infected during the entire pregnancy and have outcomes. We don't know what the percentage of moms who pass on Zika to their babies is at this point, and we don't know that just being infected with Zika will result in a birth defect. So there's a lot that we don't know, and we're working with federal and local partners to establish surveillance so that we can answer those moms' questions better. But we do understand that we don't know all the answers right now. We do believe that Guillain-Barré syndrome, so GBS, is triggered by Zika. There are a lot of other infections that trigger Zika as well, cytomegalovirus, Campylobacter, influenza. So we know that having an infection can trigger GBS. As of May 11th, 13 countries have reported either increases or Zika infections among their Guillain-Barré syndrome that they are following up with. So we do know that there is the potential for that, although it is rare. So how do we diagnose Zika? And it's a combination right now. It's based on, in Arizona, so this is different than in other countries, but in Arizona, we base it on a person's recent travel history, whether or not they have consistent symptoms, and then the results of laboratory tests. And in Arizona, we're actually lucky. I think I saw Victor. Our public health laboratory is actually one of, I'm going to say it, I'm not biased, but one of the best in the nation. We were one of the first 3 states to actually bring the triplex testing on board. So we are pretty progressive with our state lab. So we're actually able to do quite a bit of testing at our state lab. So we can run reverse transcriptase, PCR, and that actually looks for the presence of virus either in blood or urine. And we know that we can catch it during specific times in the blood, but it lasts a lot longer in the urine. We also know that we can do serologic tests that can identify Zika virus in the blood. One of the things, because we do, for every single suspect and probable Zika case, we actually do public health counseling, education, and prevention messaging. We would request that if you have a patient that you believe has Zika, please coordinate that with your local health department, because they will be able to reach out, contact that patient, help them get mosquito spray, make sure that they don't have breeding sites around that house, and they will do that for every probable or suspect Zika patient. Because really what we're trying to do is keep it out of Arizona mosquitoes. And we'll talk about why that's important. There are no vaccines or specific treatments for Zika right now. We've heard that a vaccine may be at least a year off, and that's without the safety and efficacy trials. So we're not counting on a vaccine anytime soon. So it's really prevention of mosquitoes. So you want to treat the symptoms. Tell the patients to get lots of rest, drink lots of fluid, and then they can take acetaminophen for the fever and the joint pain. So what precautions should infected people take? Because this is one of the biggest take-home messages. If you've traveled and you come back and you have Zika virus, what we want you to do is avoid Arizona mosquitoes. We want you to not only avoid mosquitoes when you're on vacation and having fun, but we want you to avoid them once you get back, because we don't want our mosquitoes getting it and passing it on to other people. And because we do know that it is transmitted sexually, we want people to avoid unprotected sex, to avoid passing that on to their sexual partner. And we want them to do that for at least 7 days, but current recommendations from CDC are to avoid mosquito bites for up to 3 weeks. So which mosquitoes spread Zika? We actually have 2 main types of mosquitoes here in Arizona. We have the Culex mosquitoes, which everyone is pretty familiar with. That's our West Nile virus mosquito. They are the ones that bite at dawn and dusk, and they're the ones that we've been talking about for forever to avoid West Nile virus. And then we have the Aedes species. And the one that we have in Arizona, our highest risk is from the Aedes aegypti mosquito. And these have been referred to by CDC as the cockroach of all mosquitoes. I don't know which one you're insulting more there with that. But these mosquitoes prefer to feed on humans. They live near humans, they're born near humans, they don't fly very far from their birthplace, and they bite all day long. So our normal messaging of stay away, use mosquito repellent at dawn to dusk, doesn't work with these guys. They bite all day long. And they can lay eggs in all water-holding containers. And all they need is the amount in a bottle cap in order to be able to lay their eggs. So they're very efficient at reproducing. So they are actually found throughout the United States, and they're found through the southern part of the United States, and then you can see up along the eastern coast. So we are considered one of the at-risk states because we have the vector here that can transmit Zika. In Arizona, we actually do surveillance for mosquitoes, and we get really excited about our mosquitoes and our mosquito finds. And so we did There's a couple ways that we got this information, but our vector control in Arizona does a really great job of trapping mosquitoes and speciating them so that we know which mosquitoes are found where. So if you look at this map, the mosquitoes are actually where traps that could trap Aedes aegypti are, and then the red dots are everywhere that we have found Aedes aegypti. So you can see we're really trying to be efficient with our testing. So we know that they like to be around people. We test where people are. So that's probably where we're going to find them most. But you can see they're mostly in central and southern Arizona. So there's a lot of things that people can do, and there's a lot of personal responsibility with Zika. So everyone has a role to play in preventing mosquito-borne diseases. So we get the question a lot, what can I do to keep myself and my family safe? And there's a lot of things that people can do. You want to remove standing water around your house and yard because, as we said, they're very efficient breeders, and they can breed in a very small amount of water and lay their eggs. So you want to make sure that you're getting rid of all standing water. And this becomes very, very important during monsoon season when we get a lot of rains, and things that you don't anticipate that can become mosquito breeding sites actually can. You want to make sure you have screens on your windows and doors so that they can't get inside to where you are. You want to wear bug spray, and we'll talk about what kind of bug spray we would recommend. And you want to protect yourself from mosquitoes all day long. So not just at dawn and dusk, which was our previous instruction. And we want people to visit their doctor immediately if they feel sick. So especially if you've had a history of travel to a place where local transmission is occurring, make sure that if you come down with fever, joint pain, rash, or red eyes, go visit your doctor, because we want to identify you, not only if you're pregnant, but if you returned. And then you want to make sure that you protect yourself from mosquitoes when you're traveling to those areas. So bring the mosquito repellent with you. You want to make sure that you have those tools. Bring long sleeves, bring pants. Make sure the hotel you're staying at either has screens on the windows or doors or has mosquito netting over the bed so that you can avoid being bitten and bringing it back. This is one of our little infographics that we put together, but it really shows people how to prevent mosquito breeding around your house. So making sure that you're cleaning out gutters, that you cover items that can collect water. One of our biggest rascals is kids' toys out in the backyard. You may not realize that wagons and, little go-karts and the driving cars actually can be water collectors during monsoon season. You want to make sure that you are treating all appropriate water if you can, so pools, fountains, those types of things. They won't breed in treated water. And you want to keep the mosquitoes outside. So the screens on the doors and windows to prevent them from getting into your house and then biting your family and your loved ones. We do recommend that if you're outside that you wear long sleeves and long pants. But we also know it's 115 degrees outside. And so sometimes wearing long sleeves and pants is just more than people can bear when it's hot and humid out during monsoon season. So then we would recommend to wear insect repellent. You want to use an EPA registered repellent, and you can use any of the following active ingredients. And I can't pronounce all of them, so I'm just going to let you guys read them. And you want to make sure that you follow the label instructions, just like you would with sunscreen. So if it tells you to reapply every 2 hours, every 6 hours, make sure that you're reapplying that. You don't have to put it on under your clothes, kind of like sunscreen. Just make sure that you're using it on the exposed areas. And because we live in Arizona, you want to make sure you're also applying your sunscreen. So sunscreen first, put that on, and then make sure you put the mosquito repellent on. One of the things that we are getting asked is, how do we protect our children? And so insect repellent can be used on babies older than 2 months. You don't want to use it on babies that are younger than 2 months old. And pregnant moms can use EPA-approved insect repellent as well. You don't want to use products that contain either oil of lemon eucalyptus or the paramethanediol on children under 3. They tend to put stuff in their mouth, and these are not things that they want to ingest or swallow. You want to make sure that you keep it out of, frequently put in their mouth, so you want to keep it out of their hands, eyes, mouth, or a cut or irritated skin. And you want to apply it just like you do. I do sunscreen on my kids all the time, so if you want to get it on their face, spray it into your hands. Don't spray it on their face, and then wipe it on their face so that you can avoid their eyes and their mouths. And then we're asking returning male travelers to protect their pregnant partners, because we do know that there is the risk of sexually transmitted Zika. We're asking men who have either lived or traveled in an area with Zika that they should use condoms, and they should use them the right way, every way. We do not know what the impact of sexually transmitted Zika is. We don't know if it has worse outcomes, if it has better outcomes. We just know that people can come down with Zika, and Zika in a pregnant woman is not a desired outcome. The other recommendation will be not to have sex for the duration of the pregnancy. We know that men can carry Zika in their semen up to 62 days, and it could be longer. That's just the latest report that we have. So the recommendation is to either use condoms or avoid sex for the duration of the pregnancy. And we do have a very strong recommendation to pregnant women: postpone your travel if you can to areas with active Zika transmission. The CDC keeps an updated map at cdc.gov/Zika, and we link to it from our website as well. So you can find all of the areas that have active Zika transmission if you're working with a pregnant mom who needs to travel. And if they can't avoid travel, we recommend that they prevent mosquito bites while they're traveling, and then you want to prevent mosquito bites, and that's general recommendations for everybody who's returning from a Zika infected or Zika endemic area. So there's actually a lot going on in Arizona to prevent this from becoming local widespread transmission. This here is a picture of the Arizona Department of Health Services Emergency Operations Center. This actually isn't our response to Zika. We do this all the time. So when a wildfire happens, when pandemic influenza hits, when we have a measles outbreak, we activate our Emergency Operations Center. And what that allows us to do is coordinate our response statewide so that we can respond to what the emergency is. We can do this in person, so this is an actual real emergency activation, or we can activate virtually. And we have actually been virtually activated in our Health Emergency Operations Center since February to respond to Zika. And for the first time ever with Zika, we've had to bring in other partners who may not have ever been involved in an emergency response before. We've brought in our birth defects registry, we've brought in our maternal and child health experts, we've brought in WIC, we've brought in all different types of partners because this is unlike any disease that we've faced before. But Arizona has responded successfully to emergencies, and we've got plans in place to deal with our mosquito-borne illness. So in public health, there's actually a coordinated system, and we all work together. So the CDC is the Centers for Disease Control and Prevention. They are the federal agency that handles public health for the entire United States. And then in Arizona, we have the state health department, and we have 15 local health departments. The local health departments are the boots on the ground. They are the ones who are working with the patients every day, who are providing recommendations, who are doing the vector control. And then we help coordinate that response statewide. And all three of these entities work together in order to get a coordinated response in Arizona. So CDC's role, they help us determine travel notices and guidelines. They help develop the educational materials for public and healthcare providers. They support laboratory testing. They're the ones that actually get the lab testing up and pushed out to the state health departments so that we can help with that. They conduct national surveillance, and they're actually working on implementing studies to learn more about Zika. to find out more about what the impact is on pregnancy, how long can it be transmitted, and identify so that we can give the best information to healthcare providers so that they can pass it on to their patients. And then they also support the national and the international response. So they're working with countries like Brazil and like the Pacific Islands. I know that they were doing a look back to determine, did those Pacific Islands see an increase in microcephaly during their outbreaks? So CDC plays a global role in Zika response. Arizona, for the past 3 years, has actually had an Arboviral Handbook. This is Arizona's plan for how we respond to the various different levels of arboviral disease. So it lays out communication plans, vector control response plans, surveillance plans, everything that Arizona would do in each specific scenario. So example for scenario 1, this is where Arizona is right now. We are at high risk for imported cases. We have a lot of people that travel to Zika impacted countries. We know that. So we have been activated for scenario 1. The plans, if you want to go look, this is actually posted publicly on our website, so you're welcome to go and take a look and see what public health's response is. But just to give you some key activities, we need to provide education about source reduction and how to avoid mosquito bites. So how do you successfully get rid of breeding sites? How do you keep your home and your family safe? And how do you avoid mosquitoes? We investigate every potential travel-associated case so that we can follow up, because we want to identify those that aren't travel-associated cases, because we want to get on those right away. We facilitate laboratory testing, get those specimens to the lab so that we can help confirm diagnoses. We track the number of cases, and we keep healthcare providers and the public informed on what is going on in Arizona. And then we collaborate with vector control counterparts. And they actually go out and trap. And let me see if that picture is there. No, it's not. They actually go out and trap, they speciate, and then they can test those mosquitoes that they capture to see if they're carrying West Nile virus, dengue, chikungunya, and Zika. We also bring the media in so that, because everybody has a role to play in mosquito prevention, we need to raise public awareness. So we try to communicate those messages out. We try to get communication out to healthcare providers so that they know what to counsel patient, what are the risks, what do they need to look for, and how do they get diagnostic testing, and then what do they tell the patients about the follow-up. We do disease surveillance. So just like a number of other diseases, we track the number of cases, where they were, what their symptoms were, so that we can identify the burden in Arizona. And that's also scenario 2, sorry. But you can see that the scenarios don't change a whole lot as you go from scenario 1, which is the locally or the travel associated, to the locally acquired cases. So we're going to do a lot of the same things, only we're also going to try to prevent any locally acquired cases from becoming more widespread. So as we find the first case that didn't have any travel anywhere, that's when we're going to really try to do localized mosquito abatement, prevention, education in neighborhoods, so that we can prevent the widespread transmission of Zika. And then as we work on that and get it back down to anticipated levels, we go into a recovery response. So enhanced surveillance for human cases, what we would do is we would watch up to make sure that they don't flare up, and that we're catching everything, and that we're keeping the disease numbers at low levels. And in order to do that, we have to decrease the mosquitoes, so we continue to watch those as well. Current Arizona activities, there's a lot that's going on right now. So we're maintaining situational awareness. We are following every day the most current international and national information that's going on. We keep very close touch with the Centers for Disease Control so that we can update any information that they get. And then we try to make sure that we get that information out to our partners so that everybody has the same level of information that we do. we have been holding for the past 3 years because Aedes aegypti not only spreads Zika, but it spreads dengue and chikungunya. So those are two other diseases that are very similar to Zika. We have not noticed the birth defects outcome with those diseases, but we have actually been working very closely in the southern part of the state on keeping outbreaks of dengue and chikungunya at bay. So this monthly Arboviral work group has been meeting in order to coordinate statewide vector control activities, develop that Arboviral response plan so that the whole state knows what the plan is, to identify and address arboviral surveillance and response needs, and to strengthen our human and mosquito surveillance so that we have a great picture of what's going on in Arizona. And then they've been working on developing protocols for the management of suspect mosquito-borne disease cases. And just to give you an idea, about 2 years ago, we had 90 plus cases of chikungunya and 90 plus cases of dengue in Arizona. The county health departments responded, and we were able to keep that at no local transmission of either of those diseases. So we've got experience in this, and we would like to keep that going. We want to keep these out of our local mosquito population. You can go to the website. Local and state health do mosquito surveillance and control. They set traps that lure Aedes aegypti mosquitoes into them so that we can find where they are and speciate them and test them to see if they're carrying Zika. We also did, I don't know if you can see this here, but we did the Great Arizona Mosquito Hunt. And this was a statewide project that was done with high school science classes. And we asked them to trap at the school, trap mosquitoes or put a trap out and see what they caught, and then they sent the traps into us. But then we gave them, the science teachers, materials to teach their kids about vector-borne diseases and mosquitoes and how dangerous they are. So it was kind of a win-win for both. And that was a really cool project that engaged a lot of high schools statewide. And then we do mosquito control through targeted larvicide and adulticide application. The sneaky thing about Aedes aegypti mosquitoes is that they like to live around people, and their breeding sites, they can breed in very, very small amounts of water. So spraying in this case, we heard the best quote at the summit, we're not going to spray and pray our way out of this one. So it's going to take targeted mosquito abatement and larvicide. The CDC has established a United States Zika pregnancy registry. And you may have heard about this last week because they made a change to it. So they had been asking states to put in women who were pregnant, had a positive lab test for Zika, and had experienced symptoms. What they're using this registry to do is to identify the impact that Zika has on pregnant women and their babies, and to follow them out long term. Well, they realized that they weren't going to get all of the information that they needed because they are starting to get potentially some information. They believed that it was just symptomatic women that were having outcomes, and now they believe that asymptomatic women can have outcomes as well. So they expanded the registry last week to include pregnant women who had a positive Zika test but did not have symptoms. And they are going to follow those women to find out what the outcomes of their pregnancy, what their outcomes of their babies are, and to follow them on to see if there's developmental or other neurological issues going on. So this is a newly updated registry that Arizona has been participating in, or will participate in. Microcephaly surveillance. So this isn't something that we had brought into infectious disease world before. So we asked our birth defects experts and our public health statisticians to go back and do a baseline. What is Arizona's baseline for microcephaly? So that we know what our baseline is, so that if we start to experience increased microcephaly cases, we'll know if that's our current baseline or if it's above, and are we seeing impacts of Zika. And those babies will be reached out to if they do have microcephaly. So we're asking providers to report cases of microcephaly so that they can be followed up on to determine, are they just part of our normal baseline? do they have Zika, or were they unidentified as Zika? And we'll do Zika testing on those babies to determine if they potentially had Zika. We'll also be discussing in blood safety. So what CDC's recommendations are to defer blood donation for 28 days after you return from travel to a Zika impacted area. And that's to keep Zika out of our blood supply, because we do know that it can potentially be transmitted through the blood. And then there's a lot that is going on a daily basis in public health. So every day, our staff are responding to inquiries from the public, from healthcare providers, from local health departments, from the media. Every day, we get suspected Zika cases reported, and so we work with local health departments to ensure that those are investigated, and then we coordinate for Zika testing. I believe that we have tested 88 people so far in Arizona. All of that has either been at the state public health lab or has gone to the Centers for Disease Control for testing. Our state public health laboratory can test for Zika virus both in humans, and we can test for Zika in blood, in urine, and in amniotic fluid, I believe. Victor's saying yes. And then we can also test to see if mosquitoes are carrying it. And then every day we are doing information sharing. One of the best ways to get information from public health is to sign up for the Arizona Health Alert Network. If you look in your folder on the right side in the business card holder, it tells you how to sign up for our health alerts. We promise we don't spam you and we don't sell that health alert, but you can sign up to get very important public health information, and we update that when we update our clinical guidance, when travel recommendations are updated, if there's antibiotic shortages that may impact patient care. We try to get all of that information out. And then you can see that we also post on our web and try to push out algorithms, clinical guidelines, updates for Zika. For the most part, we tend to follow CDC's recommendations, but there are a couple times that we make Arizona-specific recommendations. So check our website for those updates. And we do try to push that information out so that everyone gets it. And then we do a lot of public education. So you've seen a couple of these things. We do mosquito breeding site. You can see that that's one of our infographics. We put out fact sheets. We do a lot of social media and try to push it out that way. And then we're always updating our website with the most current information. And in order to keep it current, we will link to experts if it's not our information, so that it always stays evergreen and the most up-to-date that it can be. So after I gave you a lot of very high-level information, I know the question we get asked a lot is, what is the risk in Arizona? Downside, we have the right kind of mosquito here. We know that. We have the vector. And we know that we have a lot of travelers that are coming from Zika-affected areas. But the one thing in Arizona that we do have is that a lot of our houses are screened or air-conditioned. And they're not as congested as they may be in other areas. This mosquito doesn't fly very far. It stays where it usually stays in its birthplace. So having people more spread out and having them in air conditioned with closed windows or screens actually mitigates that risk. And Arizona has successfully responded to Aedes-caused outbreaks before with dengue and chikungunya. So we know it can be done. We feel that widespread transmission of Zika is relatively low risk, but we are considered a high-risk state. So that is why we have activated our HEOC and why we are taking this so seriously. So we want to thank everyone for coming. There will be time for questions during the plenaries and during the breakout sessions, because those are the true experts at those subjects. And so we hope that everybody enjoys their day, got a lot of great information, and you can follow us on social media. And again, if you're gonna tweet, hashtag ZikaAZ. Thank you.